Okay, so in the medication room, I'm going to verify the doctor's orders. Today we're doing against the MAR. Today we're injecting regular insulin, 4 units sub-Q every morning before breakfast, and Rocephin 500 milligrams IM every day. In the med room, I'm also going to be assessing the medical history and medication history of the patient, any allergies, if they have any. This patient has none. The height and weight of the patient. This patient is 5'6", 150 pounds. The age of the patient, and any pertinent lab results. So I'll be checking their last blood glucose level and their last white blood cell count level, because insulin is for maintaining blood glucose and Rocephin is an antibiotic. Now I'm going to wash my hands and I'm going to pull the medication and do my first MAR check. This is a insulin vial. The integrity of the vial and its contents are intact, and it expires on 4/21. So that is, and then I check it against the MAR and the doctor's orders to make sure I drew the right pulled the right medication. Then I'm going to check my Rocephin vial. The content of the vial and the vial itself are intact, and it expires on 4/21. And I checked that it matches the doctor's orders and the MAR, so this one is good to go. Next, I'm going to draw my medications. First, I'm going to wipe with an alcohol pad. And I'm going to drop my insulin. I'm going to drop 4 units of insulin, so I need 4 units of air. And there we go. And I'm going to put that 4 units of air into the vial. And then pull up 4 units of insulin, being careful not to touch any sterile areas. And then I'm going to scoop this cap back on very carefully and put that to the side. Now I'm going to draw up my Rocephin. I'm going to clean that vial with an alcohol pad. And then I'm going to need 1 milliliter of Rocephin, because my order is 500 milligrams and the available is 500 milligrams per milliliter. So that's 1 milliliter. So I'm going to pull up 1 milliliter. Uncap that. Put 1 milliliter of air into the vial. And 1 milliliter of Rocephin is going to come out of the vial. There we go. And scoop that cap back on carefully. And then I'm going to actually dispose of this needle head in the sharps container. I'm going to replace that for an IM injection with a sterile needle. All right, and now I'm going to gather all of my equipment and do my second MAR check. I'm going to check that I drew up the correct medications, the proper amounts of medication, my vials are correct, and everything matches the doctor's orders and the MAR. Now I'm going to gather it all up. I got my needles and syringes, my vials, my alcohol pads, and my gloves, and my doctor's orders and the MAR. So the first thing I'm going to do is knock on the patient's room. Hello, patient. My name is Nurse Erica. I'm going to take care of you today. I'm going to state why I'm here. So I'm going to say I'm giving you your insulin and Rocephin injections today. I'm going to wash my hands in the patient's room. I'm going to check the client and see who they are with 2 identifiers, and then I'm also going to check their wristband to confirm that I am in the right patient's room. Now I'm going to also do my third MAR check at the patient's bedside. I'm going to be checking the syringes, the MAR, and the vials to make sure I drew up the right meds, the right amount of medication, and then it matches the MAR and the doctor's orders. Now I'm going to ask the patient a couple questions. I'm going to ask them the place and the time of day so that I can get an assessment of their consciousness and orientation. I'm going to ask them if they have any known allergies, and this patient confirms they have no allergies. I'm going to ask them ask their knowledge of the medication and educate if necessary, and then answer any questions they may have. And then I will also ask when this medication was last received and where it was last received, so that I can be sure to rotate the site. I also would delegate help if necessary to position the patient into a comfortable position if they are not able to do that themselves. Now I'm going to put on clean gloves and discuss where I would be putting in the injections. I'm going to do the IM injection first. You can do the IM injection in a couple places. I could either do the ventrogluteal vastus lateralis or the deltoid. If I were to do the ventrogluteal, the landmarks I would put my palm on the greater trochanter, my thumb towards the groin, my index finger towards the iliac spine, and the anterior superior iliac spine, and my my middle finger towards the iliac crest. These two, my index finger and middle finger, make a V, and the injection site will be in between that V. And if I were to do the vastus lateralis, I would put my 4 fingers below the greater trochanter, 4 fingers above the patella, and my injection site would be in the middle third of the leg between those 2 points on the lateral aspect on the vastus lateralis muscle. So today I'm going to be doing the ventrogluteal site because I'm rotating from the deltoid site. They told me they got it previously, and I'm going to inspect that. I've used my anatomical landmarks, and I'm going to inspect and palpate that area for bruising and any pain or tenderness. I'm going to assist this patient into a comfortable position and ask them to relax the chosen site. I'm now going to clean the site with an antiseptic wipe and allow that to air dry. I'm then going to administer my medication. So first, I'm going to uncap my needle, and then I'm going to use the Z-Track method. Let me turn this a little. Use the Z-Track method, being careful not to go over the area that I already cleaned with the alcohol wipe. I'm going to pull the skin taut, and then I'm going to inject this needle firmly at a 90-degree angle and stabilize with my non-dominant hand as I keep the skin taut and inject slowly. And then I'm going to keep this in for about 5 to 10 seconds. Withdraw the needle at the same angle I came in, dispose of that in the sharps container, and also apply gauze with pressure, being careful not to rub the site if necessary for the patient. All right, and now I'm going to do my sub-Q injection. My sub-Q injection I can do in a couple places as well. I can do the abdomen or the upper area of the arm. The abdomen, and they told me they got it in their arm the last time, so I'm going to do the abdomen. I can do 2 inches in any direction of the umbilicus. For the arm, if I were to do the arm, I would do the upper arm, the lateral aspect of the arm. Yes, so I can do the abdomen 2 inches anywhere from the umbilicus. I'm going to inspect and palpate that area for bruises and pain and tenderness. I'm going to assist that patient into a comfortable position for this chosen site. I'm going to clean my area with an alcohol pad. I'll allow that to air dry, and then I'm going to be uncapping my needle, holding it as if it were a dart, pinching 1 inch of skin because my patient is of average size. So I only need a 1 inch of skin, and I only need to go at a 45-degree angle. I'm then going to inject the medication and withdraw my needle at the same angle that I came in. And the whole time I was keeping the skin pinched. And then I will apply gauze if necessary, applying pressure, being careful not to rub the area. All right, and this time, this goes in the sharps container. And then after I inject everything, I'm going to clean up the patient and my area, take off my gloves, wash my hands, put the bed down to its lowest setting, side rails up at least ×2, call bell, put that within reach. I'm going to reassess my patient's injection sites to make sure, inspect them and palpate them for bruises and any pain or tenderness, or assess for swelling in those areas. I'm going to make sure my patient's comfort level is met. They're in a comfortable position, not in any pain or anything like that. And then lastly, in the patient's room, I'm going to document my actions in the room, the time, the locations, initial date, sign. And that's it.